Greeting to the teaching team of pharmacology. Student number is U3244094. Today I am going to talk about methadone. Methadone is a drug used to treat severe pain due to its analgesic effect and also used in the maintenance of opioid dependence. Methadone belongs to the drug class opioids. It is synthetic agonist opioids. It is also an antagonist for N-methyl deesperate receptors. It is Schedule 8 medicine, which is controlled drugs or drugs of addiction. I'm going to talk about pharmacokinetic. Pharmacokinetic means what the body does to the drug. I'm going to discuss about absorption, distribution, metabolism, and excretion of methadone in our body. Methadone is readily absorbed and has high 60 to 70% bioavailability following oral administration. Methadone undergoes considerable tissue distribution. It has high protein binding, primarily to alpha-1 acid glycoprotein, which is 60 to 90%. Methadone is metabolized in the liver by cytochrome P450 CYP3A4 and has half-life of 15 to 60 hours, which is long half-life. Methadone is excreted via feces and renal as a metabolites and some unchanged drugs. What drug does to the body? Methadone binds and stimulates the mu-opioid receptors in the central nervous system and gastrointestinal system. Stimulation of receptors inhibits neurotransmission via decreased presynaptic calcium influx and/or increased postsynaptic potassium influx at either spinal or supraspinal sites, which alter pain perception and emotional responses within our body. Physiological effects of drugs. Physiological effects of drugs are analgesia, sedation, sleep, and euphoria. Respiratory depression is the serious adverse effects of opioid. Constipation is also one of the common effects of methadone. Other effects are excessive sedation, meiosis, nausea, and vomiting, urinary retention. Meiosis is pinpoint pupils is a diagnostic sign of an opioid dependence person. Interdisciplinary team. Methadone belongs to Schedule 8, which is controlled drug because of its nature to produce dependency. Authority is required to prescribe methadone for medical practitioner and nurse practitioner. In case of Australian Capital Territory, approval from Chief Health Officer is required to prescribe methadone, and the pharmacy also should apply for registration to dispense methadone. Harm minimization. Educating people about harmful effects, including following advice to minimize harm. Avoid using double dose of drug at a time. Inhalation is safer than injecting. Safe practice. Use of clean syringe and dispose immediately. Do not use drugs when alone. Counseling consideration. Avoid alcohol while you are in this medication. This medicine makes you drowsiness, so avoid driving or using machinery if you are affected. Take care while standing up, as this medicine makes you dizzy if you stand quickly. Always take dose as recommended by practitioner, as it can cause severe respiratory depression if taken additional dose. This medicine has common side effects such as dry mouth, drowsiness, headache, nausea and vomiting, constipation. If you experience adverse effects such as excessive sedation, hallucination, palpitation, seek emergency medical help. After discontinuing medicine, if any sign of withdrawal reaction such as nausea, vomiting, sweating, anxiety occur, seek immediate medical help. Quiz time. In which class of drugs methadone belongs to? Aminoglycosides, opioids, ACE inhibitors. The correct answer is opioids. Methadone is scheduled medicine in Australia. True or false? Answer is true. The major adverse effect of methadone overdose is respiratory depression, sweating, hair fall. Correct answer is respiratory depression.